Good evening, everyone. We'll get started. I think I've just seen Shanker's name as well, so I will refer to him if he is there. Good evening, everyone. Yeah, thank you for coming at such short notice. We've just, as I'm sure you can appreciate, the polio situation has. Can I just check everyone can see the slides and hear me? If someone could give me a nod, Vanetta. Cool, thank you. I'm sure you can appreciate over the last week or so, the polio situation has escalated, and we just thought, given this is our normal slot for Council of Members, we'd put this in. Thank you for attending. As we said, there's no obligation, and we will share the recording afterwards, as Jane's put in the chat, just to make sure people are aware that it is being recorded, so you can share that amongst your staff. What I'll do is I'll try and get through the main points on the slides as quickly as possible. And then there'll be an opportunity for practices to ask questions. We don't have all the answers, but we'll do our best to give you the latest position as we know it. What I would say is a lot of this information that I'm going to share with you has already been circulated centrally mainly, and we do apologise for the large amount of information and quite substantial documents that have been shared over the last few days. I've tried to pull out the most salient points into something which is at least a little bit shorter. So I will go through that now, and then my colleagues can chip in if needs be. So, as you know, the UK Health Security Agency declared a national polio incident due to traces of the virus found in the sewage system, which has been increasing over the last few months. This has been more prominent in London, particularly areas such as Brent, who have actually already started this campaign to increase polio immunisations. As a response to this, the JCVI has advised that we have an urgent polio vaccination response put in place across London, mainly due to prevent cases, reduce transmission, and prevent some of the worst symptoms of the disease. Resulting in this, all children from 1 to 9 living in London are to be offered the vaccine. And this is to be done by the 26th of September. So if we just point out, that's to offer the vaccine by the 26th of September, although a lot of delivery will have to happen in that time period as well. Moving on. So key messages, as I said, all 1 to 9-year-olds to be offered the vaccination by the 26th of September. Basically, that is split into 2 groups. So the 1 to 4s and the 5 to 9s. It's around 250,000 people across northwest London. For Ealing, that means around 44,000 for 1 to 9-year-olds, split reasonably, as you would find out, 18,000 for 1 to 4s and 26 for 5 to 9s. As I'm sure people have pointed out, the capacity and workload to deliver all those vaccinations is quite a demand. Additionally, just to be right, there's around 900 unregistered 1 to 4-year-olds in Ealing. Above that, from 5 to 18, there's a further 2,000 to 3,000 as well. So those people also need to be offered the vaccine. General practice is offered a standard tariff of £10.06 for the polio booster, and as it stands, the younger age group of 1 to 4 can only be vaccinated in general practice. We can deliver that across the collaborative model across PCNs or practices, so other practices can provide for others if needed, but that's the position as it stands. We are looking at alternative delivery models for the older age groups, so similar to the COVID vaccination campaign, mass vaccination, roving sites, any sort of outreach or mobile vaccinations. We still have CP House in place as it stands, who will be supporting with the vaccination programme as well, and a few of our pharmacies are able to. Vaccinators for all age groups must be registered healthcare professionals. So non-registered vaccinators that would have been used for things like the COVID vaccination cannot be used for polio. And the booster is to be offered irrespective of vaccination status. There is an algorithm for who requires the vaccine, which we'll note and people would have already seen as well. So GP ask, so mainly as I mentioned, there is an ask for general practice to vaccinate their 1 to 4 year olds, and we're asking practices within Ealing to express an interest in doing that and complete our Google documentation form. Thank you to those people who have already done it. The other thing I would also ask, this has come up for, if you are planning to vaccinate your 1 to 4s, please have consideration for families that have siblings in the 5 to 9 category as well, because what we are seeing is those groups will have to, then families will have 2 visits to do that vaccination as well. So please consider that if you are doing those vaccinations. Also, if possible, and you can do, provide vaccinations to other practices, registered patients, or work within a PCN, as I mentioned. With the Google Sheet, I'll just share what we've got so far from people in a minute when I've gone through this. Please note there's a suggested 15-minute slot for the vaccination, although experienced vaccinators will be able to do this quicker. Just to give you an idea of time, that's around, for across North West London, that's around 60,000 hours worth of workforce time. So again, depending on uptake, that's quite a lot of capacity and resource needed to do this. As I mentioned, vaccination can only be provided by registered healthcare professionals. Practices are also asked to use the clinical system searches and call in, recall where appropriate for those cohorts. And also, I know some of you will have had queries from parents already. Please just signpost, even if you're not providing that booster vaccine, please signpost and provide information where appropriate. We'll continue to provide information as to where Ealing patients can get those vaccines if your practices are not providing it. Sorry, can medical people on mute? I've got a lot of feedback. Is that just me that can hear that? Oh, thank you. Yeah, and we'll continue to provide that information where we possibly can. So just so you know what we're doing within the team, so we're working with all our colleagues to help plan that vaccination response, particularly into where we are addressing those gaps where practices can't deliver, and put on sessions where we can. There will be local and North West London comms. My colleague Manisha, who's on the call, is working with our council to do engagement with some of our more vulnerable communities as well, as we did with the COVID vaccination campaign. Also, again, just making sure we're reviewing all data to ensure no child is missed from that offer. Just to know, we have received information, well, sorry, CLCH, who are the providers of our child immunisation programme, have been provided with details on unregistered patients. That data is currently being reviewed, and we're working out a approach on how to contact them. The system letter is going out to parents on Friday the 19th of August to tell parents what to expect and provide the information on the vaccine. At the moment, I think that letter says you'll be contacted by a NHS organisation in terms of details for getting your vaccine. I know that's not going to stop parents from calling practices. As mentioned, we're working with CP House to increase their offer, as well as the pharmacies for the borough. CP House is due to close as it stands, but we are looking to extend that purely to support with the polio booster campaign, and we will be planning pop-up sites, particularly in some of the areas. People know that we did things across Acton for the roving teams, and some work with our asylum seeker hotels as well. So we are planning to increase that specifically for polio. And we will provide training and advice where needed, and particularly if practices do have training needs or staffing, please let us know about that, and we can look at what we can put on for those people. We are in the process of checking the clinical coding and systems and searches for System 1 as well, to make sure they're all in place for recording this. So I've just pulled out some of the key FAQs just to kind of highlight these. There's FAQs for parents, which went out, I think, in the newsletter, and it would have been circulated as part of the pack for practices. So just to reiterate, only registered healthcare professionals can deliver the vaccine as it stands. This is an additional jab for children that are fully up to date with the vaccinations. This will be an additional polio booster vaccination. If your child is not up to date, they'll be given the next polio dose in their vaccine schedule, so it will not be an additional dose. Okay. There are a few reasons why people cannot have that polio vaccine. Please check the Green Book for the latest guidance. And there is a small group of people, I'll highlight the algorithm, that do not need to get the dose. It's people that have had the vaccine in the last 12 months, but I'll flag the algorithm at the end for people to look at that. A couple of challenges for us as a system. Currently, there's no patient booking system for our mass and pharmacy sites. It's unlikely to be a walk-in process, so that will need to be put in place, probably via something like Eventbrite, but it will be booked appointments. We do need further assurance on clinical system data entry to make sure that goes back to the GP if if they're vaccinated elsewhere. Clinical coding is a slight issue at the moment in terms of what we code the booster as for that vaccine, so we are looking into that. And there needs to be updates around the national protocol as well for who can deliver the vaccine. Vaccine supply. Sorry, please, can people go on mute if they're not on already? Vaccine supply for mass sites and the 1 to 4 capacity within general practice. There are multiple demands going on at the moment, and whether that's COVID, whether that's just day to day, and we've already had practices that haven't said they are unable to do it, which is completely reasonable in this current climate. So we'll have to look at what capacity we've got across the system. Further information around this, myself, the borough team, will try and respond as best we can to any queries, and we'll get the latest position for you if you've got any specific issues, but you can contact the London IMS team or Public Health England. Our clinical colleagues from the CCG will also happily answer any questions. I'm sure they'd love to put their emails in the chat if they're willing to do so. That'd be great. And just 2 things on the appendices for people to note. So we'll circulate these as well to everyone. So just the booster campaign pathway. So who gets that vaccine? There's a link there in there for people to look at that, and also what vaccine will be used. So you should really know that. Just on the vaccine, just to flag, Mark, mainly because I didn't read properly, but one of the queries that people are starting to raise is just to say that it's not a single polio, it is the normal 4-in-1 or 6-in-1 vaccine. So you'll be getting more than just, parents will need to understand they're getting more than just polio when they get immunisal vaccination for polio as well. So it's not just a polio booster, which may differ in uptake for people wanting that. Gone through those relatively quickly. Shankar, is there anything you want to add before we open out to general questions? You're on mute, I can't hear you.
I just want to pick up one thing about reports, just to emphasise again a couple of points. So, this whole programme, obviously it's happened really fast, looking at data. There's a lot of clarification that perhaps we would want about how to invite the patients in the booster campaign, how to monitor whether you've delivered the activity, the boosters. This is definitely work in progress, because looking at what the best solution is, and and this is not just obviously a North West London issue, it's obviously a regional issue for the whole of London, and then there's a hope that a solution, or giving you the ideal reports, would land towards the end of next week. But this is just literally everyone working flat out, thinking of the options. Because of nuances of coding, it probably would not affect payment, but it's just more about how do you correct your recall. So I just want to emphasize the data issue. And then probably also interestingly, talking about capacity, we even this lunch had an open conversation with the CDs about what do we think about the public, the uptake. It would be really good if we had maybe a mini conversation in the chat about what people feel about the potential numbers who are eligible, and what we think might happen in terms of when we invite the response rate. Because obviously all of us are concerned about being overwhelmed in primary care, and that, you know, this 4 weeks, then we're going into our flu campaign as well. So this is obviously a very narrow window of trying to plan things. So yeah, just want to emphasize those 2 key points really.
Thank you, Shanka. Yeah, so if people do have thoughts on current uptake, if you could post that in the chat. So just to go through some of the questions, thank you to Jay and Rebecca who have been answering them. So we had a quote from Anthony around the need for it. I think Rebecca has answered that already. It's basically to provide additional protection over and above the doses that they've already had, mainly as a response to the vaccine, the poliovirus being found. The EMIS web searches will be produced in the same line with the system ones. It might even come a little bit quicker due to the fact that Brent have pushed forward and they have EMIS as it stands. If a child has just had PS4 at 4.5 years, do they still need a polio booster, and at what interval? Rebecca, can you take that? I think that's a yes, but can you answer that if that's okay, or Janka?
Oh, I can't.
Oh yeah, I can hear you.
Yes, so the algorithm that I've just put on there, the link will guide you about the age, how many vaccines a child has had, and whether or not they need a booster. So I think in theory it is if they've had the preschool booster less than 12 months, then they won't require the preschool booster less than 12 months, and they won't require this additional booster. But it's on this thing here. So if you have a little look, you'll be able to see the different ages and the schedule for when you're picking your children.
I will share my screen again with the pathway as well, which helps in that question. So one for Shanka here. I don't know if there is at the moment. Will there be a decline read code for parents who do not wish to have the children to have the vaccine?
Yeah, just sort of answered that already in the chat. There are already decline codes, but then I guess we could be still semantics about, is that declining a booster versus declining the whole childhood immunisation that they've had in the past. So there still could be semantics about how we apply that in terms of codes. But I think the first step we're saying is, you know, if they've declined in the past in terms of normal routine childhood immunisations, you probably saw the comms we sent out on Friday about, do you just do a gentle text to them to say, you know, to the parents to say, does it, you know, do they want to revisit it? But that's just really talking more about the catch up, not an additional booster. So there's no specific process of accurately recording they've declined this particular booster. It's just a generic decline code.
Thank you. Will be funded to run clinics out of hours? No, there's no additional funding for running clinics out of hours, only the service item of service payment for the additional booster, so the £10 item of service payment. G price is the first choice, help will be, oh sorry, thank you, Vanessa. Okay, thank you. I've not got any further questions in the chat. Again, this is obviously an open forum, giving you the opportunity to do so. I don't want to keep people here any longer than need to, but if you do have anything specific you'd like to ask, we'll try and answer it now. Okay. I hope that was short and helpful for people. Can you provide training for, I'm assuming that's clinical pharmacists to expand capacity? Potentially, I'll defer to Rebecca, something we can look at. I don't.
Okay, Catherine, the only thing I'll just slightly raise is, you know, the time range of this project, because if it's like, you know, we have to try and offer it within sort of 6 weeks, or even shorter really, there could be a gap, because, you know, particularly in the younger age cohort, the 1 to 4, to get that CP to go through the courses to be trained up, it may be just too late. So I think, being realistic, it may be people that already got that kind of accreditation also. So I'm just saying, being pragmatic, it may be still challenging in this period.
So what we will do is we'll take away a training ask anyway, and, you know, to see if clinical pharmacists can be included in that. I suspect probably it will be able to be, but we'll check. What levels of uptake are we hoping? We don't actually know. I know there are a few practices who have started to look into it and started to call people in. What we would really request is sort of feedback from people. There was a general consensus that it'll be quite low uptake from the clinicians we've spoken to so far, but it is a wait and see really in terms of that. And there should be sufficient stock available for the campaign, but don't hold us on that. Oh, Jay's answered and didn't answer that. Thank you. You've been reassured by NHSE. I've been reassured on lots of things by NHSE. When she's starting next week, fantastic. And as James put in, just a reminder for people to look at the capacity. I think we've had around 30 or 40 practices return as it stands, and it's very mixed in terms of people that are able to and people that aren't. So we'd be really grateful if you could do that. Schools, and we have been engaging in the school programme as well in regards to this. There are also school programmes as well which are ongoing, so it's about managing the different prioritised in terms of the immunisations for everything, not just polio at the moment. So we are working with the schools to support the programme, but whether they will be doing it or not is still up for discussion.
I think so. One of the issues was that parents aren't going to be actually at the school when they're being vaccinated. So there's an issue around patients being vaccinated whilst the parents aren't available, and the schools don't start back for another couple of weeks. So it's logistically quite difficult to get that sorted in the school settings as well.
Thank you. Yes, Anthony, it will be challenging.
Sorry, didn't that come across? I'm driving.
Yeah, sorry, Jay. So just to repeat, Jay made 2 points in terms of the school campaign. That was one, parents being available while the child is being vaccinated, and also the timelines for doing it. So schools going back, are not going back for a few more weeks, and the programme needs to start as soon as possible, really. And school holiday. Thank you, Vanessa. What about toddlers who come in for their routine 1 year IMS? Do we have to add this to the 4 vaccines given? Again, I'd defer you to the pathway algorithm, but I don't know if the clinician wants to just answer that quickly. Janka? No, thank you, Joe. Anything further from people? Okay, I won't keep anybody any longer than is necessary. Shanker, is there anything you want to say finally?
No, I mean, just echoing, obviously James reposted the link to the Google tracking spreadsheet. I know that it's another thing to click, but it is not, it is a collaborative effort to understand where we all are, and you're welcome to keep changing responses. You know, like in theory tonight, we'd hope to get initial, a deadline for practices. I know that's really tight. We only sent out on Monday. It'd be great if you could reflect on it, by tomorrow and see what your position might be. And maybe your position might also change about how you view the capacity based on what we hear from response rates initially as well. So just want to say that, just to really reassure you're not being held accountable to that. It just helps us with our planning to think where people position, their thoughts are.
Thank you very much for your time this evening. As I said, if you have any queries that come up as a result of this, please let us know. We will circulate the questions and the slides from today as well to practices as well as the recording. So thank you for your time. I will give you half an hour of your lives back. Have a good evening.
Thank you.
Thank you.
Thank you. Thank you. Bye-bye. Bye.
Thanks.